안녕하세요. 디지털 허브
Hello, I'm Dr. Chun Se-young, Digital Hub Dental Office, Digital Dentistry with the Dental TV. This is the fifth lecture. We are going to talk about the design of abutment and crown using Dental Manager software. Before, I talked about the 3D implants, and briefly, let me talk about the pre-OP workflow. As you can see here, through an oral scanner or CT, 3D data of a mouth or head and neck hard tissue is acquired. Second, with the data, designing is done with the planning software like Implant Studio of 3Shape. Using the Dental Manager, implant coordinates are designed and abutment crown designing is done. So at the bottom, you see the Dental Manager software. We are going to talk about it to design crowns and abutments. Based on the designed file, 3D printer or CNC milling machine is used to fabricate a guide, abutment, zirconia, crown in advance before surgery. 3D digital implant through CT, teeth or bone 3D data are acquired. As you can see, the surface data like 3D data of gingiva and tooth are acquired through scanning oral model, and the two data are merged. After merging the people's head and neck soft tissue, teeth and bone 3D data, designing will proceed. As you can see, teeth as reference points are matched when you do the implant designing. In terms of accuracy and precision, the patient is reproduced on the computer for designing. As you can see, based on the pre-designed teeth, implant positions are designed precisely. Conventionally, before digital implant designing, the process was done by looking at patient directly. Now on a computer, optimal positioning can be determined according to the plan. On the exact locations, implants can be placed as planned. That is the advantage of using this. If you look at the guided design and print, as you can see here, precise surgical guide can be designed after implant positions are determined. Using a 3D printer, the guide can be printed before surgery. In the previous lecture, I talked about how prosthesis can be fabricated with the implant coordinates determined in the implant studio. If you look at the 3Shape company's implant studio, prosthodontic CAD software, and Trios oral scanner is a total solution where software is connected with each other and files can be moved between them to design. Among them, I believe a 3OG file is very useful format. Most software has only 3D, CT, and oral scan data, only two of them. And between the two data, they can communicate with each other during designing. In the case of 3Shapes Implant Studio, to the 3D data, artificial prosthesis, artificial fixture coordinates can be entered. And they can be sent all together to another software. Conventionally, after placing implants, scan bodies are used to do pickup impression of the prosthesis, or they can be scanned, but now the process is not necessary. Over the fixture coordinates, the prosthesis can be designed using the wonderful file format of 3OG, which enables designing of prosthesis and abutments before surgery and prefabrication of them through CNC milling machine or 3D printer. Nowadays, this type of software is available from other companies, but 3Shape has a long history in this field, and we have accumulated the experience, and we have the system to maximize the precise surgery. So I always use the solution from 3Shape.
저는 3쉐입사의 이 솔루션들을 많이 이용하고 있습니다.
Before surgery, when we fabricate abutments and crowns, especially for immediate placement after extraction or gingiva shaping, it is before we manage the gingiva surgically. So the shape of abutment and crown is very important. First, let me talk about the abutment type. First, stuck abutment, which is a ready-made abutment, and temporary crown are made beforehand. The second, stuck abutment and link-like connection is used, and custom abutment, temporary abutment is made again, and temporary crown is used. Third, custom abutment and temporary crown are fabricated. Let's look at examples of each of them. First, stuck abutment and temporary crown. Before surgery, implant coordinates, the optimum coordinates are determined depending on the gingiva shape and crown. As gingiva is healing, relation with adjacent teeth and opposing teeth are determined. Therefore, I concentrate on shaping gingiva. So the lowest margin deep into the subgingiva abutment is used using a 3D printer. Temporary crown is fabricated. For immediate placement or immediate restoration, temporary crown is used to shape gingiva. Sometimes the temporary crown needs to be modified. Therefore, when temporary crown goes deep into subgingiva, adding or reduction can be easily made to mold gingiva. The second, I use this a lot for the maxillary anterior region. Stuck abutment link and custom abutment is fabricated. Titanium is hard to control as a material. 3D printing material, resin is used to make it, and temporary crown is also printed by a 3D printer. The stuck abutment and temporary crown on the previous one is different from this one. More precise emergence profile can be made to mold gingiva with this approach. So this is used for the anterior region. Lastly, custom abutment and temporary crown, mainly for posterior region or when fixtures are already placed, when there's no opposing teeth or we are not sure about the occlusion. Temporary is used for construction bite, and expected bite is made, and adjustment can be made in a patient. Then this method is used. Through Implant Studio, let me design first. On the Implant Studio, as you can see, crowns are designed first. After that, three-dimensional fixture coordinates are determined considering crown, bone, adjacent teeth, and gingiva. In the Implant Studio, a guide is designed. After that, the file, as you can see, is used in the Dental Manager to design prostheses and abutments. Now, occlusal plane is determined for maxilla. If this is done well on the software, when we design prosthesis, we don't need to adjust that much. Through AI, prosthesis can be designed pretty well, realistically. So if you do this process appropriately, prosthesis design can go smoother. unnecessary parts interfering with design in the upper and lower jaws are removed. Number 26 and 27, teeth locations are determined and the fixture coordinates are added as note for more precise designing in the software. This is not the most important design step, but if you do this well, it would be very helpful. This step is determining the insertion path, implant axis, and adjacent teeth are considered to design the axis, and what shape of teeth need to be determined. Here, Implant Studio, many different teeth shape libraries are available. Depending on the wearing level of the teeth, you can choose appropriate library to do the design. It is very convenient and easy to use when you try to design the tooth shape, occlusion, or contacts. Now the library is brought in. At each tooth location, the axis, tipping, the distance to the occlusal plane are considered, so roughly the tooth positions are determined. Here, as you can see, distance between the teeth and gingiva can be checked. To do the checking, we use crowns that don't go into gingiva that much, like this. The width should be matched according to the gingiva. The next step is abutment design. In that step, the part between the fixture and teeth is designed. So the teeth need to be similar to actual. Then abutments can be made in an ideal form. So we put a lot of efforts and take time in designing the crowns. This is upper and lower teeth axis, relation between functional cusp and central grooves. Overjet relation, teeth axis or width is not good. So this is adjusting number 26 tooth, occlusal plane, functional cusp, antagonists, central grooves. Tooth width, tip or the tooth tip should be adjusted. And the rotation is also made matching the arch form, especially the axis between number 25 tooth and number 6 tooth. Embrasure side or mesial shape should be properly designed to prevent food impaction. Such things need to be considered in designing teeth. The most important thing in this stage is occlusion. Occlusion with antagonists is important, but also implant fixture axis is very important. In the long run, if occlusal force is applied off the implant long axis, a lot of torque can occur, leading to connection or screw problems between the fixtures and abutments, or abutment and crown. Prosthesis lifespan can be reduced as well. Also, prosthesis fracture or screw loosening can occur. These things need to be considered during designing. Next step is to select abutments. Right after surgery, I use the stock abutment, as I said before. I prefer abutments that go down deep subgingivally because the tooth formed from the abutment margin is printed as temporary, and the temporary can be easily reduced or added depending on the gingiva shape or the tooth contour. The modifications can be made easily before final prosthesis is delivered, depending on the surrounding environment or fixtures, or any errors or deficiencies can be corrected between a couple of months to 6 months before final prosthesis is mounted. So I use stuck abutments a lot. At number 6, between the stuck abutment and margin, pre-designed crown. There's a cuff to form emergence profile. Now it is being designed. So the gingiva at this situation can be shown half transparently on the software. Gingiva form can be molded whatever the form we may want. That is the advantage of the software, the CAD software. If you do trimming or resin adding in actual patient, it is a bloody environment, not very good. Using a handpiece is also presenting problems, difficulties. The rough gingiva shape and margin shape is checked. Trimming or adding at the connection part can be done to make ideal and healthy gingiva shape. When the final prosthesis is delivered, the health needs to be maintained for a long time through emergence profile or soft tissue support. The health is also dependent on the boundary between the crown and gingiva, so all these things need to be considered before moving on to the finishing stage. If you use the software for the first time, there's some difficulties to anyone who tried for the first time, but if you try several times and when you can achieve good outcome from patients, you will realize it's rewarding to spend time to get skilled in using the software. So that's what I have felt often. So you need to use the software skillfully in order to minimize the time spent at chairside in front of a patient. It will give you the time saving for you, as well as the patient who has to be subjected to painful treatment. So from the clinic, surgeon, and patient's perspective, this is a very helpful solution. Now what you are seeing is the design completed, and now we are checking whether something is missing or something needs to be corrected, looking at the gingiva or the fixture or the adjacent environment. All the designing is completed. As you can see, I used the library of teeth whose occlusal surface is worn. By looking at the adjacent teeth and the opposing teeth, you can tell the patient is rather aged. So the teeth is designed with a lot of attrition. So after completing the design, STL file of crowns is sent to the 3D printer, and the temporaries are fabricated. The abutment is a stock abutment. So if you order abutments to Osstem, abutment and temporary crowns are fabricated to complete the pre-op workflow. Now the last temporary crown is made. On the occlusal surface, the occlusal points are adjusted with the numerical numbers. After the adjustment, in order to minimize the occlusal adjustment later, we check whether there are anything missing during the designing work. This is the last step of the designing. On the left, you see the plus key, minus key, and water drop symbols. The plus key means crown. Something can be added to the crown. And the minus key means trimming can be done with that tool. Such deficiencies in the design can be adjusted using a mouse. So actually fabricated temporary crown can be delivered to the patient, fitting very well. If you use a guided surgery to position fixtures appropriately, the temporary can be delivered to the patient with just a little adjustment when it is set to the patient. This is a screw type which I prefer to use for temporary because the margin is very deep. Temporary or final cement is not easy to be removed. So SCRP type is used and the screw is loosened to remove the abutment extraorally, and cement is removed and margin contour is easily adjusted. To easily mount and remove them, a screw hole is made. Screw retain type is what I prefer for temporary crown. I talked about designing abutments and crowns using Dental Manager software. Practice makes it perfect. Based on what you learned today, with your practice, I hope you can enjoy more complete designing activities. Let's go to Q&A session. The first question, do you do the designing in your clinic yourself? If so, your management efficiency may decrease quite a lot. Very good question. This is something I thought about a lot before. At the beginning, I did the designing myself in my clinic. Right now, we have a lab technician who is handling the designing to check each patient's unique occlusion or relation to adjacent teeth. The final confirmation is always made by me because when you see a patient, we need to consider so many things like occlusion status or the shape of an implant and the bone surrounding the implant, gingiva. So many things need to be considered for the design. So if the lab technician handle all of them, it would be good, but it is not always the case. And we are the ultimate people to take the responsibility for the prosthesis. Therefore, we need to make important decisions ourselves, knowing the situation. In terms of the management efficiency, current software is advanced so much in terms of time and the cost. It is very good to use. You need to see patients all day long, and if you have to do the CAD work yourself, it's not very efficient. In the short-term perspective, management efficiency can be lowered. However, in terms of the clinical quality, with a long-term perspective, the management efficiency can increase. So that is the solution I use. Depending on your situation, you need to choose an appropriate solution. Second question, does a prosthesis designed with a computer precise enough to be used clinically? The reason I adopted the digital approach was to do modeless prosthesis ortho treatment. So I adopted the digital. I cannot say it is 100% precise when you use oral scanner or milling machine or a 3D printer. However, based on my 5 to 6 years experience in this area, errors are made in a lab if you use a conventional approach in an external lab during taking rubber impression, stone pouring, model making, or pin work. Also at a lab, if it goes through many technicians, errors are added. Compared to it, if you use CAD software for designing, errors are limited to an intraoral scanner or milling machine. So the prosthesis designed with the computer is far more precise. That's the conclusion I reached. Therefore, I use it in my clinic. If you look at the current situation, implant studio is used to come up with the implant coordinates, and prostheses are made. The prosthesis is very precise, and if you can do the surgery very precisely, very precise prosthesis can be fabricated. That's what I can say. Third question, is there a software easier to use? If you don't have a lab technician in your clinic, isn't the software difficult to use? Currently, the clinic system in Korea and in other countries as well, there are not many local clinics with lab technicians. So if you have a lab technician, the work can be done more easily and efficiently. But the software is being updated and upgraded so that clinics without local lab technicians can use it easily. Right now, using the software, depending on the clinic's situation, may be a little bit difficult. But as I said before, if you practice and make efforts within short period of time, easily the prosthesis can be designed and printed using a printer or milling machine. And then you can share the work with your staff easily. It depends on how you approach it in terms of your thinking. And I think it's not that challenging to use the system, the solution. The time is limited, so you may have further questions. And we have offline digital dentistry lectures available for you. This concludes today's lecture. I'll come back with Introduction to One Guided System next time. I am Dr. Chun Se-young, Digital Hub Dental Office. Thank you.
감사합니다.